Now it is time for today's perspective, and coronavirus might feel like something confined to history. But of course, behind the scenes, much needed work to identify where the next threat might come from. It is work under attack as we speak from some sides, global health funding being viciously cut. But one man and his team have rather won the health lottery. Dr. Christian Happi is a world-renowned professor of molecular biology and genomics. His current project that he co-founded has just won $100 million for research. He's also just been named at the end of last year, in fact, in Time's 100 most influential people of 2025. Thanks very much for being with us on the programme. Good to have you with us. Start off by telling us then what the project is. What's your aim in this project?
Well, this project is basically aiming to set up, to expand an early warning system for pandemic preemption and response. And it is a system that we actually piloted in 2014 and then scaled up during COVID-19. And at this point, we want to expand that project across many African countries and eventually use that as a use case in order to actually have what we call to scale up globally. The system is based on three major pillars. First is early detection in near real time of known and unknown pathogen. And secondly, transmitting information, for those pathogens found in or tested or detected in real time to a network of national public health institutions that can use the data and the information to act in a very coordinated and in a very accurate way. The third pillar of the project is basically is called Empower. That is basically strengthening frontline healthcare workers and then building a resilient health system that can help us to respond to epidemic in a way that is very coordinated and in a way that is very efficient. We've tested this system across many African countries where we've worked, and we've demonstrated that it works. We contain epidemics early enough, and then we've also through that system, you see how Africa responded to the COVID-19 in the early phase because we actually had the ability to detect much more earlier and also share information in real time and also build the workforce and train people in doing those detections in real time in the countries and using the data to inform public health response.
We often hear, don't we? We often hear that coronavirus is not the end of it, that there will be another pandemic. I mean, presumably you would agree with that?
I would definitely agree with that. I think the issue of the next pandemic, it is not if there will be, I think it is when it will happen. There is a study from the EIT that actually said in the next 10 years that there's a strong possibility there will be another pandemic that will result in millions of deaths if action is not taken. So clearly the issue is not if, but it is when, but it's also preventable. If we actually can work together as a global health community and address and set up a very strong resilience surveillance system and share the data in a way that is responsible, that way we can avert that from happening. But if we don't do this, then we eventually have to go back.
How do you do that? I mean, how do you start? Where do you start? I mean, it must be a huge field that you're trying to analyze and access to enable you to really pinpoint where the next threat could come from.
Well, I think we all know for now that at least 70% of pathogens that have the potential to lead to a pandemic are actually in Africa. And I think there are areas where we need to focus. We see areas, every year we have about over 100 epidemics in Africa. It's clear, the signs are clear that this is where the hotspot is, and this is where we need to make the necessary investment. We need to make the case, and we need to strengthen the health system to set up this resilient surveillance system and also put together, a data sharing mechanism and profit mechanism that can allow people to actually share data, knowing fully well that we can exploit the data to actually ensure global health security, but also giving back to the communities, where some of these things are occurring.
I saw an interview you did in The Guardian recently. You talked about the fact that you feel like you've won the health lottery, but that it's a very lonely business out there at the moment. I mean, so many cuts elsewhere. How difficult is it having all that money when many of your colleagues presumably are finding things extremely tough?
I mean, it is difficult, very, very difficult. I like that story as a child that is playing soccer, with other colleagues in the field. You have a ball, but then suddenly you find yourself in the middle of the field with a ball and alone, and you have no player to play with. So, I mean, no other co-players to play with. I think this is the way we feel at the moment. It's very, I don't think it's a good feeling when you have resources in a community that, who used to have resources and where you used to collaborate and where you used to work together. So how much of those resources actually could help support and then and enable collaboration with others? I think we need to think about an ecosystem that is well funded. It is when this ecosystem is well funded that we can partner, we can collaborate. But having only one group like ours having the resources actually is also a limit. I mean, it's very limiting in the sense that how much can we do with that in a community that used to have much more than this? So, and I think it's important that we call on not only partners out there, but I think call on African leaders. Actually, I will talk about the case of Africa to make the necessary investment. We need to invest where the mouth is, and let's make the necessary investment. Let's be intentional about the investment that we want to set up. For surveillance. Yes, the governments are trying, but at least they can do more.
What do those cuts mean? And would you call it dangerous even?
Can you come again, please?
What do the cuts mean? I mean, would you call it dangerous even, the fact that these cuts have been implemented worldwide, really?
It is dangerous. I think, we are all, I would say we as humans are what I call an endangered species. And if care is not taken, these viruses and these pathogens can actually just, eliminate all of us. We can be extincted. So it's a competition for survival. We need, therefore, to invest actually not only to find these viruses before they come to us, but actually develop the right countermeasures that will enable us to be protected against them. The reality is, whether we like it or not, we are, keep invading, their space. There's more interaction between human and then the environment. And in the environment, there are things that we know, there are things that we don't know, and then things that could be very little for mankind. So therefore, we have to be very proactive. We need to make the necessary investment, and we shouldn't look at this investment as waste. It's not a luxury. Our survival, it shouldn't be treated as a luxury. We need to make an intentional investment for us, to develop the countermeasures to protect us so that we can outlive those dangerous pathogens that are out there. If we don't do that, we will have to pay the consequences.
Just time to ask you one last question. I noticed you mentioned Africa a couple of times, and I know you feel very strongly, don't you, that it should be African scientists and African institutions who are really getting involved in all this, because it's very important for the continent.
Yes, it is not only important for the continent, but for the world, because Africa is not only endowed with minerals and then human resources. Africa is endowed with very powerful biodiversity. As part of the African biodiversity, you're going to see a myriad of pathogens and things that we know, things that we don't know. And therefore, we need to invest where these things are. So I think by investing in Africa and the African scientists taking the lead, we are going not only to actually detect these pathogens, but also find solutions that will protect not only Africa, but for the rest of the world. Remember that we are in a world that is very dynamic. Today, if you have a disease outbreak that starts in a very remote area of Africa, it will take less than 24 hours to human migration for potentially that virus that is starting in a place where nobody knows in Europe to find itself in the marketplace in Europe because people travel. So, and therefore, we should look at this as a global health security problem, not just an African problem, but Africans should try to lead because they understand the ecosystem, they understand the terrain, then and the technology, they can deploy the technology close to the places where these things happen. We don't need to wait for a month, for an outbreak to start and then for us to start solution. These are things that can be found within weeks, and we should be able to share those solutions, not only to protect the Africa health security, for Africa health security, but also to ensure that we use the information and then the data, as well as the tools that we can actually develop from that to ensure global health security.
Good to have you with us on the programme today. Thank you very much for joining us. Dr. Christian Happi joining us there for today's perspective. Thanks very much. And as I said earlier, second perspective coming up for you in around half an hour's time. So stay with us for that.